Awareness ratios are about 10 to 12. Lung sounds are clear bilaterally.
Hello, I'm Bob Kepshire, Director of Emergency and Community Services here at University Hospital. I'd like to take this opportunity to talk to you a little bit about our involvement with the community clinics located in Richmond County. This past year, University has given over $1 million to the various clinics in Richmond County. This money was used to help support the operational mission of those clinics, as well as help fund an indigent care pharmacy program that the Neighborhood Improvement Project administers. With that said, I'd like to highlight that clinic in particular because it is one of the larger clinics in the area. I work pretty closely with the leadership at the 30906 clinic, and they have really played a vital role in really being a safety gap for a large segment of the population who's really falling through the cracks. There's a lot of people who use the emergency department as their primary care provider, and that's really not appropriate use of the emergency department. So what we've done in working with the clinic is we have case managers here in the ER who will help identify patients who don't have primary care physicians. And what we'll do is we'll see them here in the emergency room, but folks do need follow-up care. So the case managers will actually make appointments at the clinic, and they actually can get established with the physician at that clinic. So the clinic becomes their source for primary care. They have actually a patient-physician relationship with the doctor there, and that becomes their family doctor. So in the future, if they have a minor illness, a cold, or need something with their medications adjusted, they call the clinic as opposed to coming to the emergency department. The whole point is they're getting better care. It's more holistic. It's really following a good continuity of care, and it's really keeping the emergency department open to really care for the true emergencies that may come in. I really think we'd be in dire straits if it weren't for the 30906 clinic and the rest of the clinics in Richmond County. They're really meeting a need that's out there, and being in an urban area, that's a growing need. So without them, I don't know what we'd do. So I think the continued support of the clinics is in the vital interest of not only the community, but also the facility.
Well, if it wasn't for here, I wouldn't have nowhere to go.
Our patients right now, again, are self-pay, Medicare, Medicaid, indigent, and most of our patients are indigent. And I think that the patients like Ms. Tyson started off as indigent patients, and we had a lot of problems with getting medicines and making sure that we could adequately take care of her diabetes. With the case management services this year, she's not only been able to decrease her hemoglobin A1C, which is one of our most important indicators of how well we're taking care of her diabetes. She pretty much earned a pen. So we gave her a I Reached My Goal pen because she actually did.
I'm a diabetic, high blood pressure, got arthritis. She said I had thin bones, and lately I had a crook in my neck from a wreck, I guess, happened in 2006, and it went from my neck on down to my shoulder. I had to go to the emergency room for that, so I talked to her about that today. So hitting it on pretty good. Only thing I don't like is giving myself a shot.
Her risk for heart attack and stroke was extremely high. Now she's normal. And she's normal because she's taking advantage of the case management services. She exercises. She watches her diet. She meets with the case manager monthly, goes over her diet plan. She comes to the diabetes education classes, and she is just a star patient.
But I do my exercise. You see, I'm doing good. My cholesterol and high blood pressure and all that was fine today, so I'm good to go. I'm good to go.
I have students that are in clinical placements for community and public health nursing, and so we use this as one of our clinical sites. And the reason that I bring students here is that, and I've been bringing students to this site for about 3 years, is that I find that this is a very unique clinical opportunity for the students for 2 reasons. Number one, they have a registered nurse case manager that carries the caseload and makes home visits on some of the patients that come here to the clinic that the students can go out with. And number two, the clinic itself is unique in that it serves a population that my students don't get to see in either the health department or when they go out with the home health nurses. They kind of sort of see people who fall through the cracks of the traditional healthcare system, and they get to do lots of hands-on things while they're here, and they really like coming to this clinic very much.
Chronic medical conditions need a different level of care. In order to have someone that's able to handle that level of care, the complexity that comes with low income is something that we're very proud of. And again, if it wasn't me, the fact that it comes with this center. Neighborhood Health Services Center has a full-time physician. We have 2 nurses. We have specialty care and neurologist, an OBGYN doctor, and dentist, and they're all paid through grants that University Hospital supplies to us yearly.
If we'd had to pay for it, put it this way, we wouldn't have no place to live. We'd have to live in a cardboard box under a bridge. And all the staff has been real good about finding places and stuff like that. And it's not just me, it's everybody that comes here. 90% of them don't have decent medical. And if it wasn't for the staff, they wouldn't get it.
I'm in this area because this is where I grew up. I take care of some of my classmates' mothers, some of my classmates who've been unfortunate. I think we do an excellent job here. The only reason we're here is because university has supported us, and I'm emotional about it. I'm blessed. A lot of the people that we take care of without the help from University Hospital would be dead. There's no way to dress that up.